Okay, sir. Okay. Shall I continue?
Continue, sir.
Okay, sir. Okay. Shall we start? Shall we continue?
Yes, sir.
Okay. Now we were learning about gross anatomy of bone. I have told about. I was telling about the distal epiphysis. Distal epiphysis at the bottom. You can see it is. It appears in gray color. That is called articular cartilage. Distal, here they have mentioned distal epiphysis. The meaning of distal means bottom of the bone, and proximal epiphysis means top portion of the bone. So when we were standing, so distal part will be near the ground, and proximal epiphysis, it is just opposite to the ground. Then you can see spongy bone, that is inside the bone. You can see epiphyseal line and red bone marrow. Red bone marrow is the main source for producing red blood cell. Then endosteum, outer part of the bone, and compact bone. So full portion of the bone. Next you can see anterior view of skeletal system. Okay. At the top you can see skull. Anterior view of skeletal system. First one, I am starting from top, that is skull. Then just above the teeth you can see maxilla bone. Then you can see chin, straight to the chin. Chin is located in mandible bone. Then you can see clavicle, that is nothing but your collarbone. Then you can see a blade structure bone, that is scapula. If you just keep your hand behind your shoulder, below the shoulder, backside of your shoulder, you can see, you can feel the blade structure, that is called scapula bone. Then humerus bone. Humerus bone is nothing but below the shoulder.
Bhaskar, sir, you can resume.
Shall I continue, sir?
Yeah, continue, sir.
Okay, sir. Okay. Hello.
Yes, sir.
Okay. Next, scapula bone. After that, humerus bone. That is nothing but it is above the elbow and below the shoulder bone. Then sternum is located at your center of your chest. Then ribs bone. Ribs bone, it is your chest bone. Nothing but it is your chest bone, and it is covering the full internal organs on our upper body. Then vertebral column, that is nothing but your spine bone. Next you can see below the elbow there are two bones, that is radius. Another one is ulna. The radius is just locating below your thumb finger. If you take your thumb finger, below the thumb finger there is joint, then the radius bone is continuing. Then below straight your small finger, you can see your ulna bone. So next one is, you can see carpal's bone, which is located in your wrist joints. Then metacarpal is just below the wrist bone and above your fingers. These are the bones called metacarpals. Then phalanges is nothing but your fingers. So next bone, ilium, that is your hip bone, top blade of your hip bone. We can feel by keeping your hand on your hip at the lateral side. Then you can see sacrum, then coccyx, then pubis. So these are the bones are located in your spine. Next one is femur. Femur is nothing but your leg bone. We can say that is your thigh bone. So femur bone is the strongest bone in your body, and it is a longest bone in your one of the longest bone in your body. Next one is patella. Patella is nothing but your knee joint. If you feel your knee joint, you can see a round shape bone that is called patella bone. The next one is tibialis, tibia bone. The next one is fibula. Tibia bone is where it's located. Do you know that? Okay. If you see your right leg, for example, you take your right leg, there is a small ball structure at the outside of the bone, just above the ankle. So straight to that. Next one is, sorry, I told you about just above the ankle, there is a ball structure. Along with that, fibula bone is starting and ending with knee joint. Then another one bone is tibia. Tibia is the biggest bone in leg that is located below your knee. Next, you can see dorsal bones. Dorsal bones are located in your ankle joints. So next one is metatarsals. Metatarsal is located just below your ankle and above your leg fingers. So these are called metatarsals. The next one you can see phalanges. Phalanges bones are located in leg. You can see your leg bones, leg fingers. These are called phalanges. There are 5 phalanges bones are in your, there are 5 fingers. These are called phalanges. Okay, next one. Next one you can see posterior view of skeletal system. Posterior means back side view of the skeletal system. Anterior means front view of your skeletal system. Now we are going to learn what are the bones are in posterior view of skeletal system. The first one is skull. Already we have seen that. The next one is scapula bone, which is located below backside of your shoulder. And next one is humerus bone. That is nothing but it is located in hand, just below the shoulder and above the elbow. The next one is radius. Radius and ulna. Radius and ulna bone. We are going to learn where it is located. Already I have explained you. Once again, I will explain you. If you see your right hand thumb finger, just along with that, below the wrist, it is straight to the right thumb finger. That is called radius bone. Ulna bone is, it is just straight here. If you see your palm and your small finger, right hand small finger, that's it. Lateral side, you can see the bone is, that bone is called ulna bone. So that helps to rotate the arms, which is below the elbow portion. The next one is femur. That is the longest bone and one of the strongest bone. And next one is pelvis. That is nothing but your hip bone. Next one is fibula. That is the biggest bone in leg. That is below the, that is located below your knee and above the ankle. Fibula and tibia. Okay, next one. Can you see the vertebral column? Now we are going to learn the main and importance bone for our human body to keep the body straight. That is vertebral column. The another name is spine.
Bhaskar sir.
There are 7 bones. It appears in orange color. The next one is thoracic spine. Thoracic spine has 12 bones. Thoracic spine has 12 bones. You might have learned, you have learned ribs bone, about ribs bone. Where is it located? And that ribs bone start from sternum and ends and joins with the thoracic spine. So next one is lumbar spine. Lumbar spine has 5 bones that is marked in yellow color. So these 5 and coccyx, you can see coccyx bone. It has 4 bones, but it appears as a single bone. It merged together and appears as a single bone. And sacrum also, sacrum and coccyx, all these 2 bones are joined together, merged together, and appears like a single bone. So by this you can understand there are 33 bones are in the human vertebral column. So these are the main bones for keeping the body erect and acting against the gravity throughout the day. Throughout the day, we use our spine bone to keep our body straight. So whatever muscles are located at the back side are called anti-gravity muscles. Do you know what is the reason they have given this name for this bone? These muscles are anti-gravity because these bones are helping the body, upper body, to keep our upper body straight. Though it pulls by the body, weight is pulled by gravity, but due to anti-gravity muscle, it helps to keep our body straight. You might have seen old age people when they stand straight. It is very difficult for them to stand straight for a long time because of weakness of anti-gravity muscles. If you don't develop your backside muscles, anti-gravity muscles, you cannot stand straight for a long time. Those are having back pain, they cannot also stand for a long time because of this anti-gravity muscle. Muscles are not having enough strength to face the gravity force. So you have to keep in mind when you when you give exercise for people who are having lower back pain and those who are aged. Okay, next one you can see the vertebral column. It appears in the side view inside a human body. You can see cervical bone. As I told you, there are 7. It appears in lavender color. Then thoracic spine. It is starting from T1 to T12 because there are 12 bones. So that is called thoracic. You can see yellow color. It is starting from brain to the bottom of the spine. That is called spinal cord. Yes, sir?
Screen share all, sir.
Sir?
Screen share all, sir.
Oh, screen share ஆகலையா? சபா சார் வந்து ஸ்கிரீன் ஷேர் பண்ணாரு. ஒருவேளை பவர் ஆஃப் நினைக்கிறேன் அவருக்கு. நான் இப்ப ஸ்கிரீன் ஷேர் பண்றேன் சார்.
சார் கரெக்டா இருக்கு இல்லையா? உதயகுமார் சார்.
சொல்லுங்க சார்.
உங்க ஸ்கிரீன்ல தெரியலையா?
தெரியல சார்.
இல்ல அவரோட வீடியோ தெரியல.
தெரியும் சார்.
என்ன தெரியுது இப்போ? வெர்டிகல் காலம் தெரியுதா?
ஓகே சார்.
பாஸ்கர்.
ஓகே சார்.
பாஸ்கரன் சார்.
எஸ் சார்.
சார் உங்களோட வியூ மட்டும் தான் தெரியல. இங்க ஸ்கிரீன் கரெக்ட்டா தான் தெரியுது. இல்ல
அவர் தான் வந்து சொல்றாரு தெரியல அப்படின்னு.
சரி சரி நான் செக் பண்ணிட்டேன். எனக்கு ஆல்டர்னேட்டிவ் ஒன்று வச்சிருக்கேன், அதுல கிளியரா இருக்கு.
ஓகே சார், அவர் தான் சொல்றாரு. நான் பார்க்கல, நான் வந்து இங்க
ஓகே ஓகே. உங்களுடைய
என்னுடைய ஸ்லைட் பார்த்துட்டு இருக்கேன்.
வீடியோ தான் மியூட்ல இருக்கு சார்.
என்ன சார்?
உங்களுடைய வீடியோ மட்டும் தான் மியூட்ல இருக்குது.
ஓகே சார், ஓகே சார்.
now continue sir.
Okay sir, okay. Okay, next one is we are learning about vertebral column. So I have told you that there is a yellow color line starting from brain to bottom of the spine, that is called spinal cord. So all the body nerves passes through that spinal cord only. Next one is conus medullaris. It is a part of the spinal cord. Then caudua equina, that is also part of the spinal cord. Then you can see the disc in between two vertebra bones. You can see white color. It marks with white color, and you can see the name of that white portion is called disc. Then you can see the right side cervical bone, thoracic bones, lumbar bones marking, then sacral bones, then coccyx bone at the bottom. So another name for the coccyx bone is tailbone. Next one is classification of bones on the basis of shape. So here we are going to learn the types of bones on the basis of their shape, or we can say their structure. So on the basis of shape, first type of bone is long bones. So these bones are appearing in long size than they wide. So these kind of bones, they are not wider. It has a lengthy structure. So we can say femur and metacarpal bones. So it appears thin, but same time it appears very lengthy. So femur bone and metacarpal bones are the example for long bones. The next one is short bones. Short bones has cube-shaped bones. We can see the wrist joint, ankle joint. They have cube-shaped bones. These are called short bones. And another one is sesamoid bones within tendons. Because that one is, example is patella bone. It is located on your knee. So we can feel that there is tendons passing through the patella bone. The hard portion of the tendons is called patella bone. The next bone is flat bones. Flat bones structure is like a thin and flat, and it's slightly curved. The sternum bone, which is located on your center of your chest. Then skull bone. So these are the bones, example for flat bones. You can witness the skull bone, it appears flat, and sternum bone is also looks in flat structure, and it appears very thin in the size. The next one is irregular bones. Irregular bones are located in our body, in our spine, that is vertebra bones. It appears with the complicated shapes. The shapes are not in a regular manner. So that is called irregular bones. Then hips bone. Hips bone is also one of the example for irregular bones. Now you can see the various types of bones on the basis of bone structure, bone shape. Here in right side, you can see the flat bone, sternum. It is located at your center of your chest and joining all the ribs bone together. The next one is at your right side, short bones, that is talus. Talus is located just behind your ankle, leg ankle, that is called heel bone. We say heel bone. So the anatomical name is talus. Left side you can see irregular bone example, that is vertebra bone, that is located in your vertebra column. And in between two vertebra, you have seen in the last slide, it appeared in white color, that is disc. So the top of the left side, you can see the humerus bone, that is the example for long bone. Okay, next one is the skeletal system. There are two divisions in skeletal system. The first one is axial skeleton. You can see the skull. The skull is the example for that. The next one is appendicular skeleton. That is your femur bone. So next one is part of the skeletal system. There are 4 parts in our skeleton system. The one is bone, that is nothing but skeleton. The second one is joints. The third one is cartilages. The fourth one is ligaments. So these 4 components join together and making the skeletal system. So next one is classification of bones on the basis of features. Here you can see there are 2 basic types of bone tissue on the basis of features. First one is compact bone. It appears in dense and looks smooth. Then homogeneous bone. The next type is spongy bone. Spongy bone, which it appears small needle-like pieces of bone. It has many open spaces. Okay, next slide. That is the 14th slide. Here we are going to learn about bone fractures. So what is the meaning of bone fractures? The definition of bone fractures: a break in the continuity of the bone. A break in the continuity of a bone is called bone fracture. Okay, or simply we can say a break in a bone. Next one is type of bones fractures. Here we are going to learn what are the types of bone fractures. First one is closed fractures. Second one is open or compound fracture. We can call closed fracture as simple fracture also. So how to differentiate closed fracture from open fracture? When there is break in the bone, at the same time, it doesn't penetrate the skin. The bone, the broken bone or piece of the bone doesn't penetrate the skin, then it is considered as a closed or simple fracture. When you see open fracture, that is compound fracture, is the broken piece of the bone or broken bone penetrates through the skin, is called open fracture. Bone fractures are treated by reduction or immobilization. So here we are going to learn what is the first aid for the bone fracture. We should not move the fractured area. That is the first thing we have to follow when there is fracture. Next one is, you can see the X-ray of a fracture bone. That is X-ray of humerus bone. That is located above your elbow and below your shoulder. The humerus bone is located in your arm, that is above the elbow and below the shoulder. So here you can see the bone fracture X-ray. So here they have given radius and ulnar bone, and there they have marked with the black color humerus bone. So here we can see the simple fracture, that is called closed fracture, because the broken bone doesn't penetrate the skin. So this is called open fracture. So this X-ray is the example for the open fracture. The next one is common types of fractures. There are 6 fractures are mentioned here. The first one is comminuted fracture. Comminuted fracture means the fracture bones broken into many pieces. At the same time, it doesn't penetrate the skin. So this fracture is coming under closed fracture, and exact name for this fracture is comminuted fracture. This kind of fracture particularly happens to the aged people because they don't have more calcium in the bone. Due to deficiency of bone, it very easy to break into several pieces. So next fracture is compression fracture. This is also one of the closed fracture. Closed fracture, one of the closed fracture example. Here you can see an object hit on the skull bone and crushed the bone, and the bone crushed by the heavy material. You can see there is some portion is went inside the skull. So this kind of injuries happens very rarely. The next one is impacted bone fracture. So due to this fracture, broken bone ends are forced into each other. Commonly occurs when one attempt to break a fall with outstretched arms. The next one is spiral fracture. You can see the spiral fracture. The end of the fracture bone occurs excessive twisting. It happens due to excessive twisting. So this kind of spiral fracture happens. This is the most common fracture, happens in sports activity, during sports activity. Next one is green stick fracture. This kind of fracture happens to children. And here sometimes bone doesn't break, but at the same time you can see the bend in bone structure. And some of the green stick fracture, bone breaks incompletely because it happens only children, because the children bones are having more flexibility due to tender nature. So next one is type of bone fractures. So here one more slide. I have given you the clear picture of the different type of bone fractures. First one is transverse. Transverse is parallel to the bottom of the bone, and linear. First one is horizontally, fracture happens horizontally, and linear fracture, you can see the fracture happens vertically and oblique. Here you can see diagonally bone has broken, and here you can see oblique, but it is bones are displaced from its position. So in this fracture, fourth fracture, you can see in the oblique displaced fracture, the bones end is, the bone is moved from its position. The next one is spiral fracture. You can see the spiral fracture. It happens due to forced, due to both ends, broken bones ends are forced into each other. The next one is green stick fracture. The next, another one is comminuted fracture. Comminuted fracture means the bone pieces are more in the fractures, broken pieces. So today we have learned about the definition of anatomy and physiology, and anatomy and physiology of bone, and gross anatomy of bone, and anterior posterior view of skeletal system, then vertebral column and their different bones, and classifications of bones on the basis of shape, and division of the skeletal system, then types of bone fractures, and examples for the common type of fractures. So next, so today I am wind up this class. So we will meet in the coming anatomy and physiology classes. Thank you, one and all.
Thank you very much, sir. Bhaskar sir, you can take your wonderful session. So,
Okay, sir.
it's, human anatomy, physiology is a very tough subject, but you can easy to convey the message to deliver your knowledge. So I thank you very much.
Okay, sir.
So you take a wonderful session. Thank you very much, sir.
Okay, sir. Thank you very much, sir.
Thank you, sir.
Thank you, ma'am.
Any doubt is there?
Any doubt regarding the anatomy session?
Okay, sir.
Thank you very much.